Hello friends, today we'll be discussing the effect of coffee on the health of heart patients. Usually a lot of cardiac patients come to us on a daily basis and ask us whether they should be permitted to have how many cups of coffee, whether the coffee will affect the health of the patient adversely, and whether the patients who are having a significant habit of taking coffee, multiple cups of coffee, and they're maybe so-called coffee addicts, how whether these patients should be permitted to take as many cups of coffee, and what are the direct or indirect benefits or harms of taking these many cups of coffee. These are the points which we'll be discussing in this topic. The effect of coffee pertaining to the cardiovascular system. Usually coffee might be having some direct effects and some indirect effects as well. Usually coffee causes increase of the blood pressure. The blood pressure is stimulated or increased by the effect of the caffeine which is present inside the coffee. Usually the people who are hypertensive might have a transient increase of the blood pressure because of the effect of caffeine. Although it does not recommend that every person who is taking multiple cups of coffee should be put on antihypertensive medicines, because usually the effect of caffeine on the blood pressure of the patient is usually transient. But still, if at all the patient is having significant blood pressure rise, then the patient might be required to be put on antihypertensive medicines. Then the heart rate of the patients might be significantly increased because of the effect of caffeine. Caffeine can cause increased amount of stress hormones inside the body. These stress hormones stimulate the heart of the patient, and thereby they increase the chances of the patient having palpitations, patient having tachycardia, patients having arrhythmia. Sometimes dangerous arrhythmias might also be triggered by these catecholamines. That is why any patient who has electrical instability or significant cardiovascular problem, or is having a history of multiple ectopics, should cut down on the number of cups of coffee which they are taking. At least maximum 1 to 2 cups should be permitted in these patients, because the frequency of arrhythmias will be much higher in these patients if at all they are taking multiple cups of coffee, and especially when the coffee is of a stronger type in which the patient is having a much higher concentration of this caffeine or coffee powder inside the coffee. These are the patients who will be much more prone to have arrhythmias, and sometimes that might be dangerous also for the life of the patient. That is why any patient with significant heart failure or any dangerous form of arrhythmia should be advised to abstain from coffee as much as possible. Maximum 1 to 2 cups can be permitted in these patients. Some beneficial effects of coffee might be seen in the terms of cholesterol of the patient. It increases there is some evidence that coffee might affect the LDL cholesterol of the patient in a bad way. It might increase the cholesterol of the patient. So the patient who are trying to have a good cholesterol control should be advised to abstain from coffee. And there might be some indirect effects of coffee as well, because coffee comes with a lot of milk also. Most of the people who take coffee usually take coffee having a large amount of milk. Very little patient would be taking a dark coffee or a milkless coffee. I think that is comparatively less, or a complete black coffee. Majority of the people do take it with a lot of milk, and milk comes with added calories. A lot of these people take sugar also along with coffee, and if at all you take that much amount of sugar, it will have a definitely direct and indirect effect on the cardiovascular parameters, the diabetes of the patient, the cholesterol levels of the patient, and overall the calorie intake of the patient. Any cup of coffee usually contains around 80 to 120 calorie. The more is the amount of sugar, the more is the amount of milk. In this, the more will be the calories. If at all the person is taking maybe 5 to 6 cups of coffee every day, that will add to around 500 to 600 calories every day. And the more intake of coffee will aggravate the cardiovascular problems for the patient. If at all the patient is already obese and is having a significant metabolic problem, there are high chances that the patient will have significant amount of dyslipidemia and metabolic problems, and the diabetes control of the patient might also worsen if at all the patient is having a high intake of a coffee. There might be some effects of beneficial effects of coffee if at all the patient is taking a good amount of coffee. Coffee has some antioxidants which can reduce the amount of free radicals inside the body. Usually this might be having some protective effects on the heart, but although this effect is not very consistent, and usually this should not be considered to be a reason by which because of which the people are taking excessive amount of coffee. Coffee can affect the acidity of the patient also. Usually it can increase the chances of the patient having acid reflux and heartburn. And in a patient who is already taking aspirin, which is also in itself a reason for having acidity and heartburn, there can be an increased risk of having acidity related problems, and gastric ulcers that might also be formed inside the stomach of the patient. That is why usually patients having acidity related problems should be advised not to take too much amount of coffee, especially the patients having a cardiovascular problem as well, because aspirin and coffee together might increase the chances of GI bleeds and ulcers. Coffee might increase the anxiety and jitteriness of the patient. It might make the people more and more nervous. The amount of stress hormones which might be released inside the body of the patient and cortisol which might be released can adversely affect the cardiovascular health of the patient, and that it can increase the risk of heart attacks. Usually stress in any form or stress hormones in any form can increase the risk of cardiac arrhythmias, and they can increase the risk of heart attacks also in these patients. That is why any patient with a significant cardiovascular or clotting related problem should be advised to take not more than 1 to 2 cups per day. Some studies show that coffee might be having a beneficial effect in terms of diabetes. It might reduce the risk of having a type 2 diabetes by improving the insulin sensitivity. But practically speaking, if at all you are taking 5 to 6 cups of coffee every day, that might have an added amount of or a large amount of sugar and a large amount of milk, and that will worsen the metabolic problems of the patient. An excessive amount of coffee will indirectly affect the diabetes function of the patient, although some direct benefit might be seen, but that is not proven by big studies. So that is why all diabetic patients are ideally not advised to take too much amount of coffee. Similarly, for the blood pressure also, usually it might stimulate the blood pressure, but people may or may not be required to take more blood pressure medicines because of this. Any patient with hypertension might be recommended not to take too much amount of coffee. Coffee can induce some diuresis also. Some amount of excessive urine production might be seen in a patient who is taking coffee. If all the patient is having taking a cardiac medicine which is already causing some diuresis, then increased output of urine might be seen in the patient, which might lead to dehydration of the patient. Sometimes the patient might go into a sudden hypotension or sudden BP drop, which might be detrimental for the patient. Usually what is recommended that any heart patient should not take more than 400 milligrams of caffeine per day, which is equivalent to around 4 cups of coffee every day. The lesser you take, the better it is. The more amount of coffee or caffeine you take, the worse it is for patients, especially with a patient having a severe amount of heart failure or unstable angina or arrhythmia-related problem. Patients having a significant amount of heart failure also should keep the amount of water or fluid also which is going along with coffee. That also should be kept in mind. Every cup of coffee might be around 150 to 200 ml, and 4 to 5 cups per day might mean 1 liter of water. And people with severe heart failure are usually kept on a fluid restricted diet. That means they are allowed only maximum 1 liter per day. So that excess amount of coffee should also be kept in the calculation of fluids for which the patient is subsequently required to take lesser amount of water for the entire day. So these are the cardiovascular significance effects and side effects and impact of coffee on the health of a patient. We have discussed this topic in regards to the risk to the heart patient. If at all you have any comments, queries or suggestions pertaining to this topic, or if at all you have any other questions pertaining to this topic or any other topic, any patient related queries, you can write to us about them in the comment section below. The people who are new to my channel, I would request them to subscribe to my channel, as this gives us a lot of motivation and inspiration to continue the channel in future. And if at all you do not find time to see all the topics in great detail, you want to just get a brief summary of most of the topics, for these people we have a habit of regularly uploading YouTube shorts in which we are uploading a 1-minute brief summary of all the topics. You can find these topics on our YouTube shorts, and we'll also be uploading these topics to Instagram and Facebook reels also. So you can follow us on Instagram and Facebook, and there you can get these reels on our channel on a regular basis.